Hello, this is Dr. Joseph Chameleon. Thank you very much for registering to receive these videos. I've prepared 6 in this series, all of which will be sent to you over the next couple of weeks to help you understand and decide whether this is the ideal treatment for the replacement of your missing teeth or perhaps those of your family or friends. I've entitled this series Keyhole Implant Dentistry for Missing Teeth. I trust that the information I'll share with you will help you to make a decision as to whether this is the ideal treatment for your particular situation. So let's take a look at our first slide. Well, why do we call it keyhole implant dentistry? Basically, as the name implies, keyhole surgery is a very minimally invasive, conservative way of attending to general medical situations, as is the case in dental situations. The actual penetration, or shall we say the surgical site, is relatively minor. It's only a 1.5 to 2.5 millimeter opening that we create through the soft tissue, through the gum, into the bone of the jaw, and only to a depth of about 5 or 6 millimeters. The implants we place through that opening are anywhere between 6 and 14 millimeters in length, and these implants are self-tapping. They screw into the bone structure, and because they're made of titanium, they actually become physically fused with the bone of our jaws after a 6-month period. Here you can see an implant being placed through that keyhole, what we call the pilot hole, in fact, and once that's seated in position, this is the appearance. The appearance is that of just a stalk protruding from the gum, and it's that foundation on which we can place a porcelain tooth. Here it is here. It takes about 2 weeks between the insertion of the implant and its placement or completion. I think you'll agree this is a very nice way of eliminating that gap. Replacement of a missing front tooth in just one visit, eliminating the need to wear a large acrylic partial denture, is our first case. Let's have a look at this. Often we find people are missing the one or other of the front teeth as a consequence of an accident or very deep fillings in the past. Sometimes root-filled teeth can have metal rods in the center, which we call posts, and they can lead to the splitting of the root and eventual removal. But the problem is that many dentists replace these individual teeth with large acrylic dentures. You can see there's the missing tooth, and this is the extent of the very large base plate, we call it, or the acrylic plate that actually carries that false tooth. A very large lump of plastic to have in your mouth for the sake of one single tooth. There's the gap, and quite sincerely, that was an overkill, having all that plastic in the mouth completely unnecessarily. In this slide you can see the implant protruding from the gum, looking at it from underneath, and upon completion of the implant the temporary crown is fabricated, and you can see that within one short visit the implant is positioned, and you can see that the temporary tooth is quite reasonable. So accordingly this patient is free of his denture within one visit. Very straightforward. The porcelain tooth is fabricated by the laboratory, and 2 weeks later is cemented on top of that foundation. You can see that's a beautiful looking natural tooth. Looks very, very nice. Looks as though it's actually growing out of the gum. So here's the implant once again, looking at it from underneath. And the crown is fitted, cemented on top of that to create a nice natural contour, free of that large amount of plastic that was covering the roof of the mouth, which in fact can lead to more gum disease and tooth decay around the adjacent teeth. Instead of a plastic denture, often dentists will make a large chrome partial denture. Let's look at this situation. Again, just a single tooth missing and a large amount of metal to sit in the roof of the mouth to carry that one single tooth. Sometimes those clasps at the back can be unsightly and really aesthetically unappealing. Here's an x-ray of the implant within the jawbone. Interestingly enough, you can see here that's about a 14 millimeter depth, and there is no pain associated with placing an implant in the bone. The bone has no nerve endings, so accordingly, whether it be a 6 millimeter penetration or a 14 millimeter penetration, there is no pain from the bone structure of the jaw. However, it's only the gum that will actually cause a little bit of pain, and as you saw, it's a minor intrusion, a minor penetration through the gum that is required to place these implants. I'm sure you'll agree that's a much better looking false tooth in terms of a porcelain tooth rather than the large metal framework this patient was wearing previously. Let's take a look at a case of the replacement of a single missing side tooth in just one visit, immediately improving the appearance. Here is a slide that shows the space where the tooth has been extracted and the keyhole, the pilot hole that is penetrated through the soft tissue to accommodate this little implant. Here you can see the stalk of the implant, as I mentioned before, but the actual implant is more like 14 millimeters of thread within the jawbone to anchor that foundation. As you can see, the porcelain crown looks lovely. It actually looks like it's growing out of the gum. A very natural looking appearance and a lovely outcome for this patient. Let's now take a look at the replacement of missing side teeth in one visit, again restoring the ability to chew and immediately improving the appearance. I'm sure you'll agree that this patient has a lot of problems, missing teeth on the upper jaw and the lower jaw. In fact, this patient is completely unable to chew with her right side. There's no connection of upper teeth against lower teeth. Accordingly, the placement of implants will make a big difference to her smile and to her chewing function. This slide indicates the missing molars on the lower jaw, and right along that ridge we're about to place two little implants. There we are. You can see there's no blood, there's no swelling, there's no stitches. It's the ideal way to have your missing teeth replaced. The X-ray indicates that two upper implants have been placed and two lower implants to carry those molars. Here we are. The laboratory has fabricated the two porcelain teeth. They look very, very natural. And in the patient's mouth, they do indeed look extremely natural. It's a wonderful way to be able to help patients. I simply love doing this sort of treatment for my patients because it really is a life-changing situation to be able to suddenly have perfect chewing ability and, of course, the acceptable smile. In the upper jaw, we have two implants to replace the missing teeth, and there they are. The porcelain teeth are in position, cemented to create this final result, which is a complete smile on the right side, as well as teeth that actually lock top on bottom. In other words, the upper teeth have something to chew against on the lower teeth. So if I can assist you in any way, please do not hesitate to email me, as you can see down the bottom of the screen, keyholeimplantdentist@gmail.com. Please feel free to email me your questions, and I'll be delighted to answer them. Or if you would like to meet me personally and discuss your particular situation, you can contact my practice on 1300 966 663. That's 1300 966 663. And for the details of our address, please go to www.keyholeimplantdentist.com and you'll find all of the information there. www.keyholeimplantdentist.com. This information is also available at the bottom of each email that I sent you. I hope to meet you very soon, and I hope this first video has been of interest to you. Bye for now.